Not many people know what the prostate gland looks like, so we're going to show everybody, do a little show and tell.
So you can see there how you have sort of an apple-shaped organ. The important thing here, and of course there's a lot of anatomy that's not on this image, but this line that goes in here and sort of comes out the bottom is the urethra. So a picture above this line is the bladder that sort of collects the urine, okay? So as the bladder collects urine, it passes it through the prostate. And that's important because this means that, of course, you can have cancer anywhere inside this organ. And part of the challenge and the reason why rectal examination has lost a little bit of its use or need as a good intervention to try to prevent prostate cancer is because when you do a rectal examination, you're sort of only palpating the posterior part of that apple. You're not able to palpate any of the interior part of that. So that's the challenge. You can have urologic symptoms of which you're not necessarily going to feel anything abnormal. Now, the overall size of the prostate gland on an examination is important. So it is still important to, especially if you're having urinary symptoms, have a rectal examination. But a rectal examination as itself won't necessarily prevent you from having prostate cancer, and that's an important point.
But it's interesting to note that prostate cancer moves generally slowly.
Correct. So prostate cancer generally moves slowly. So again, the question is, how do you find that subtype of men? What are the risk factors, and how can we better identify those men that may have an even more increased risk than sort of the general population? So, for example, things like your family history, dad, brothers. If there's prostate cancer in your family, then you have increased risk. Age, of course, is important. So once you get to 50 years old, it's important that your doc has a conversation with you.